Welcome to our Community Spotlight mini-series here on Business RadioX. We are enthusiastic about supporting our local community, and I'm joined now by the CEO of Eastside Medical Center, Trent Lind. And Trent, first of all, welcome to our Community Spotlight.
Hey, thanks, Mike. Appreciate the opportunity to talk to you and the rest of the community.
Absolutely. We, of course, are doing this remotely because of the whole COVID-19 and the social distancing. A lot of things have been upset in our normal routine these days, obviously. You guys are on the front line at Eastside Medical Center. What's it looking like from your perspective? How are you guys holding up there at Eastside Medical Center?
Yeah, we're doing great, Mike. I appreciate the question. We started this journey a little over a month ago, and it's amazing. It feels like it's been many years that we've been in the midst of COVID-19. But we started just a little over a month ago, seeing some of the rumblings of first patients in Georgia, and our ability here at Eastside to begin to really kind of lock down our boundaries, begin screening processes for employees and for visitors, and then even further locking down our system, reducing and then eliminating our elective surgeries for the time being. Really going to a no visitor policy with just rare exceptions. And then, again, we've had a lot of those restrictions in place for some time, but in the midst of this as well, we've seen really a reduction in volume overall. We've seen half of our typical ER visits. We've seen obviously reduction in surgeries based on the fact that we're not doing elective surgical cases that can wait until after some things clear up and create a safer environment for our patients. And really, at the end of the day, I think the community at large has really been a little bit leery to come to a hospital, which I don't fully blame them. And then, on top of that, really have heeded the warning of the governor to shelter in place. And we thank everyone who's really heeded that warning and done their part to help flatten the curve, which has been the goal. So, but that said, we have seen our fair share of COVID positive patients. To date, we have tested well over 150 patients, getting closer to 200 patients that we've tested. We've seen over really about 40 patients, I think the number is at now, that have come back positive. And of that, we've seen our fair share of really critically ill patients, which unfortunately, as you've seen in the news, sometimes the outcomes are not desirable and not the way that we want to see the outcomes go. But it is part of this virus.
It sounds like you guys have not been overwhelmed, though. You still have rooms, you still have beds, you're still operating at full capacity.
Yeah, we're I say to some extent, with the exception of our reduction in elective procedures and cases, we are really wide open for patients to come to Eastside and receive emergent services, or receive care from an outpatient perspective. But at the end of the day, again, I think it's been a month of us seeing Eastside change in form. We've really been what I would use the analogy as the waters have receded. We're waiting for that tsunami of patients to come. But really the good thing from a projection perspective is right now we're recognizing that projections were well over emphasized in the beginning. Really, we anticipated at one time we could see anywhere from 3 times or 5 times our normal volumes here at Eastside, and especially in our ICU or intensive care area. Fortunately, the curve again has been flattened by our public doing the right thing, staying home, and we feel that those projections will be a lot lighter. We're really not sure at this point if we've seen our peak or not. Still projected for the peak to be anywhere from April 22nd to some projections show early May. But really, at this point, we are really wide open. We actually, with the state, had presented ourselves as a surge hospital, if you will. We've been announced by Governor Kemp as a hospital that would provide service for overflow patients if we need to help our sister hospitals and health systems across Metro Atlanta decompress their volumes.
Yeah, and you mentioned the peak, and it looks like it is going to be late April. How are you guys intaking patients right now, or people that think they have some of the symptoms? I've heard of hospitals where they're set up outside. People aren't even leaving their cars, and they're able to be tested. Have you made any kinds of those changes with your hospital?
Yeah, really, we've been fortunate from our network of care, and you and I, Mike, have spoken about our network and our expanded network here at Eastside. We've really been able to utilize our urgent cares as a point of access for testing for patients that are ambulatory. those patients that come to our ER now or are coming via EMS, or they're coming via walk-in, but in a real critical state for the most part. So those patients that are coming here and really need inpatient services, we'll test those patients here. For those patients that are ambulatory, we really suggest that they go to the urgent care network, Eastside Urgent Care, or even telemedicine. We've got a lot of options that we've utilized via telemedicine with our Eastside Primary Care group, and or through our urgent care network, where patients can access those providers and have kind of that over the phone or online evaluation done, and at that point be directed to the right location for next steps.
Speaking of, if you have maybe some of the symptoms, I've heard you should not just go to the hospital, you should call first. Is that the case?
Yeah, absolutely. It is something we emphasized from the get-go. We were concerned that our ER would become overwhelmed. To your point, one thing we did put in place early on, as we locked down our access points to the facility and began screening process, and then further locked down our visitor policy, we actually added a tent out front of the hospital. That was called our surge tent, internally, but it was intended to be used for if volumes increased to a point where we had to use waiting space as a location to triage patients, that we'd be able to overflow into that tent. That's what a lot of other health systems have gone to early on. We haven't seen the need, just because of our network of care, to have to go that direction. I will say it's important to point out, though, as much as we are glad that patients heeded that warning, we are a safe place to come. We've proven that. We've had no employees that have been tested positive as a result of an interaction with the patient here at Eastside. That's something we're very proud of. And it was because of our proactive approach to really locking down our boundaries, creating different access points for our patients, and directing them in the right way across the community, that we've been able to really create a safe environment. We've utilized our PPE, personal protective equipment. Everybody's learned that term over the past few weeks and months. We used it really prudently, but at the same time, we used it in a fashion that those frontline caregivers were given the appropriate protective gear so that they stayed safe, even in the midst of this challenging patient population.
And I was going to ask you about your employees and the staff and the doctors and the nurses. How are they holding up? They doing okay? As not just health-wise, but I know probably they're always on call right now. So how's everybody doing there?
They're doing great, and we really appreciate the question and the support from the community. Our employees, especially those frontline nurses and radiology techs and respiratory therapists and ER staff, all those folks that are frontline interacting with these patients on a daily basis, housekeepers, food service, phlebotomists, all those individuals that are interacting with these patients on a daily basis. Certainly, it not only brings a really challenging work environment, it's a very resource and labor intensive a way to care for patients who, with the donning and doffing of personal protective equipment, all that goes into it. It's a labor intensive, but also an emotionally draining care environment. And so we just can't thank enough our staff for the way they stepped up, our physicians. But in that, they've been fueled day in and day out by the support from our community. Our community has stepped up like I've never expected our community could step up. Everyone wants to know what they can do to support, and they've come in droves with supplies, with free meals, with letters of support, with banners of support. I mean, it's never ending. It's every day. Literally, I'm going to get off this call with you today. Hope and I are going to walk down and take a delivery from a local board member of ours who is bringing droves of masks and other personal protective equipment to be able to further supplement our needs.
That's wonderful. Congratulations, Trent. It's so great to hear all this good news, really, as far as how efficient it's been at Eastside Medical Center. It's a safe place. The cases have been a little bit lower there at your site as well, but you are ready for the peak. It sounds like you are as prepared as can be. Before we let you go, and again, it's Trent Lind, the CEO of Eastside Medical Center, joining us here on our Community Spotlight. Any message or myth you want to debunk, or any last final words for the general public out there from the CEO of Eastside Medical?
Yeah, thanks for that, Mike. First and foremost, back to the point of being a safe environment, we are entering a new norm, and COVID is going to be with us, and it's going to be with us for at least another 9 to 12 months without a vaccination, maybe even longer. And it will be with us after that vaccination comes and after we figure out more effective treatment options as we learn more about the virus. That said, we've got to get back to a state of where we can have faith that we're going to create a safe environment in our hospitals. Eastside has gone above and beyond to create that kind of environment for our patients to feel comfortable. If they're coming to the ER for treatment, if they're coming to our hospital to receive surgical care and then have a surgery they've been holding off for the past month, but are in pain and in need of that surgery. So we are creating a safe environment for our patients, for our community, to support them in a deeper way. But at the same time, continue to make sure that you're monitoring the recommendations from our state Department of Health, from our federal government in regards to what are the things that we can do as citizens in the community to heed the warning, to make sure that we're continuing to follow the social distancing guidance, to continue to shelter in place as long as that remains an edict from our state government. Those are all the things that have helped us to really allow our health systems not to get into, and our hospitals not to get into a state where we're overburdened with patients and not able to really provide the care that we need to in our health system here, at least locally, because we've seen it happen in other countries and other states, and we've been fortunate here in Georgia and specifically here in the greater Gwinnett community to be able to really get through this to this point in time in a manner that is manageable.
All right, Trent, I know you have a lot more important things to do than talk to me right now. So thank you so much for joining us here on Community Spotlight. Trent Lind, the CEO of Eastside Medical Center. Keep up the great work, and thanks again.